There's been 3 waves of opioid overdose deaths, the first occurring in the 1990s due to a rise of opioids being prescribed. The second wave due to heroin happens in 2010, and the third wave begins in 2013 due to synthetic opioids, particularly fentanyl. Everyone can be affected by this due to the ripple effect involved. The problem: the high rates of death and misuse make the opioid epidemic a serious public health issue. Treating the issue involves prevention and education campaigns, treatment access, and greater funding.
Drug overdose deaths in the United States had a disproportionate increase between race. Black and American Indian/Alaska Native people had larger increases, 44% and 39%, compared to rates among white people, 22%. Drug overdose death rates increased with increasing county-level income inequality. One study attempted to see what social determinants of health played the biggest role throughout different stages of treatment and addiction. It proved that relationships with people with substance use and abuse and deviant substance use problems are associated with increased initiation and severity of an individual's substance use disorder. White patients received medication for opioid use disorder up to 80% more frequently than Black patients and up to 25% more frequently than Hispanic patients. Patients made similar numbers of visits to healthcare providers in the 6 months following such an event, indicating that disparities in treatments are not explained by low content with care. But white communities also have more access to treatments, like buprenorphine, which is a life-saving drug. From a scoping review, this is a table of SDOHs and how they affect opioid use disorder by the number of studies found to impact that SDOH.
For strategies, our target population was very broad, including all adults and specific high-risk populations in medical and community settings. Our intended audience was patients with increased risk factors, those prescribed or taking opioids, and all adults in general medical settings. One SEM-level intervention was evaluation of a program to screen patients in community pharmacies for opioid misuse and overdose. And one evidence-based intervention was to reduce the proportion of prescription pain reliever misuse initiation in the past year. I pulled some information that says 65% of individuals aged 12 years and over reported prescription pain reliever misuse initiation in the past 12 months in 2021. But then it decreased to 47% in 2022.
So when you look at the issue of prescribed opioid abuse from the community levels, there's many ways to protect and prevent vulnerable groups from falling victim to it. So by using evidence-based interventions like reducing the proportion of prescription pain relievers, misuse and death can be avoided. Reducing prescriptions combats the issue of misuse by not allowing as many stray pills to be around the house, lowering the probability of an individual's gaining a dependence addiction. And the reduction will turn heads in general to make a shift on people's mindsets and bring attention to the misuse issue. Now what? With the pressing issue of opioid overuse, something needs to be done now. With this new intervention of reducing prescription amounts and screening individuals before prescribing them, we can hope that misuse of extra prescribed opioids can be lowered across the country. Now, communities can be better educated by taking these extra precautions while being prescribed something so fragile. How will this make an impact? These interventions will make a significant impact on this issue by bringing attention to how easy it is to become addicted and dependent on substance, even if it is legally prescribed. These interventions will allow for other opportunities such as pain management programs to help individuals not rely on opioids. It will make healthcare and communities create a safe and educated environment surrounding pain relief and opioid medication.
Opioids can be a successful pain reliever when used in moderation within a medical practice. The most two common illegal opioids are heroin and fentanyl. The addictive ease of pain and sense of euphoria ultimately led to the estimated 54,743 deaths in 2024. Pharmacies offer screenings for individuals to determine their level of overdose risk, as well as refer patients for substance use disorder treatment and furthering patient and pharmacist education. It's shown that younger adults ranging from 18 years to 25 are at a higher risk of overdose, along with those who have mental disorders or even post-traumatic stress disorder.